Hi, it's Angie. I'm coming on now to do a video just explaining a little bit about how I've been post-op after having an ACDF spinal procedure 2 weeks ago. 2 weeks ago tomorrow. Um, so it's anterior cervical discectomy and fusion. Not an overly uncommon surgery, but the reason I've decided to come on and talk about this particular side of things is because there's not very many videos in the UK on the subject. The ones I did sort of have a look on like YouTube when I knew I was needing the surgery, and they were all very much in the US. And I think generally it's very much the same. There are several maybe slight differences, but I just thought I'd come on because it might help someone else who is going to have this surgery or going through surgery. Um, I will say straight off, right at the beginning, my surgeon was correct when he said it's not an overly painful recovery. The pain that you have probably been experiencing before having this surgery is way off the scale to what you'll have post-op, unless obviously unfortunately something does go wrong and you have complications. But generally speaking, what you'll get after surgery is more discomfort, more annoying than anything else. Most of it just your usual post-op bruising, swelling, that sort of thing. So I'll start with when I was sort of waking up in recovery after my surgery. This is actually my 10th surgery, not spinal. They've all been abdominal and kidney in the past. And I've always found when I've been waking up, I tend to wake up with a very dry mouth, very dry throat. My brain wakes up before my body. I'm aware of everything that's going around me, but I can't move. And I actually found quite different this time. I woke up and more or less straight away I could move myself, which was unusual. And I didn't have that sore, dry, tickly throat, which was fantastic, as given that the area that they actually go in and operate on is here. What they do is they go in at the side of your neck. Now they've gone in on me, it was my right hand side. And apparently it depends on whether your surgeon is right or left-handed. If they're left-handed, they'll go in on the left-hand side of your neck. So they go in and they move your trachea, your vocal cords, all to one side. And that is probably the bit that gives you most concern after surgery. Some people can have quite, not bad, but more swallowing issues than others. I think I've done really well. Again, a bit annoying, but I'll tell you a little bit more about that in a minute. So I woke up actually feeling quite good. I wasn't in pain. I'd been suffering with my left hand. The fusion was on C5 and C6, so it was affecting those four fingers on my left hand and my shoulders, like pre-surgery mainly. And as soon as I woke up, I could tell I hadn't got that pain, that all the nerve sensations that I had been getting, the tingles, the well, if you've got nerve sensations, you'll know what I mean. It's not one feeling, it's many different types of feeling, and it can change throughout the day, from day to day, from week to week. I didn't have the burning sensation down my spine anymore. I didn't have the itchiness. Oh, the itchiness between my fingers was horrible. I did still have a numb hand, and that is still numb. How much of that will disappear within time, I don't know, but my surgeon does think that possibly some of that could be permanent. Now, if that is the case, I can live with it. It's weird, like when I wash my hair, I can't like rub my hair properly. I can't hold a knife or a fork in that hand. I've still got to be careful with grip because I could still drop things, but it's not quite as, although it's numb, I have more of a sensation, like a normal sensation. I'm not getting the feelings in my fingers like I'm being stabbed with pieces of glass. I can move my fingers pretty well. There's still a bit of stiffness, still got that stiff feeling in the back of my hand that I had, but it's not painful. It's not like I've been hit with a hammer anymore. So all in all, that's good. The idea of this surgery, certainly for me, wasn't to reduce the symptoms that I'd already got. It's to stop them getting any worse, because it is a life-threatening condition, because it's your central nervous system. It affects your brain, your spine. Obviously your brain affects everything that your body does, and if that isn't working properly, then over time everything else is not going to work properly. So time is of the essence to get this surgery done, because the quicker you can have it done, the less likely of having more permanent damage occurs. So got back to my room. I didn't know whether I'd be lying on my front, my side and back or what, but I was on my back. I was well propped up. My neck was well supported. I had a little oxygen thing up my nose. Blood pressure cuff was on, automatically taking obs every 15 minutes. I wasn't particularly, I say my brain was awake, but my eyes weren't particularly open at this point. But I was aware that there was people there practically all the time, taking my obs, taking my temperature, asking me if I was all right, asking me if I wanted some water. Was I in pain, and all the usual kind of things. So actually, almost as soon as I got back to my room, I needed to go for a wee. I thought, great. Now, I don't know whether other countries catheterize people after this operation, but certainly in the UK they don't, because obviously after spinal surgery, one of the things that they need to know that is working is your bladder. So they do not want to compromise that any further than it already is because of your spinal problems. So that was fun. They just got me settled in my room, and I decided that I needed the loo. So they had to, I'd also got fluids going into me. So I'd got a drip in my left hand with the fluids, and I've got a drain coming out of my neck on the right hand side. So I got like a bag of bullets attached to me that was coming out of me. And I'd also got, in the UK, they tend to put, I don't know what the proper names is, I call them leg cuffs. They're like a big version of a blood pressure cuff that you put around your arm when you have your blood pressure taken. And there's basically an air tube that attaches to them, and that attaches to a machine, and it just pumps air. So they inflate just the same as a blood pressure cuff, but sort of from your ankle to your knee, and it massages the back of your thighs, so it reduces the risk of blood clots. Excuse me. So I had to be unhooked from that. They had to unhook me from my oxygen. They had to unhook me from my fluids. It was like, oh God. So I went and I weed a lot, loads. And they did say that I'd already had in recovery, I'd already had a bag of fluids, so that was why. Because I was thinking, where's all that come from? So anyway, got me settled back in. Oh, I did walk to the toilet myself with holding onto a nurse. I felt okay. I felt a bit not lightheaded, just well post anaesthetic-y, I suppose. That usual, not quite with it, floaty feeling. But I was okay. She helped me with my. She sort of held my bag and everything while I had a wee, and she got me settled back into bed and connected me back up to everything. That was fine. And she went and got me some iced water then as well, and a straw. Bendy straws are excellent because you can't bend your neck sort of to drink, but a bendy straw, you can bend it to you. So I could well recommend some bendy straws in possibly for recovery. Lots of drinks, lots of little sips of drinks. So sorry, my throat's going now. So yeah, nothing really happened. I gradually got more awake, and I put the telly on, and I got the remote control next to me, so I was just watching the telly. Then at some point, they were coming in by this time probably every half an hour for my obs. I eventually got rid of the oxygen and the fluids, and I was just left with my drain and my leg cuff things that are really noisy and poppy, but they're great. And probably like a couple of hours later, I needed to go to the loo again. And the same nurse came in, and I'm like, I'm really sorry, I need to go again. And she was like, don't be silly, you can't go in your bed, can you? You need help. So she unhooked my leg things, and again, she helped me to the toilet, and I felt a lot more with it that time, and that was fine. Hooked me back up again. And she bought me, I think it was around that time, she bought me some ice cream and jelly, which was lovely, the ice cream on my throat. Then after that, I had a sandwich at some point, and I found that I could eat really normally, which surprised me because I thought there'd be soreness or tenderness, swallowing problems. The only thing I had found is as soon as I got out of bed the first time, I felt like I'd got, if you have like laryngitis and you've got like phlegm around your vocal cords, I felt a bit like that. But as soon as I got out of bed and got moving, I actually was able to cough it up, which is good because that's what you want to do because you don't want it on your chest. And I felt a lot better. And throughout the day, I'd cough up little bits of like jelly like stuff, and it just had like a little bit of blood in it, just like small blood clots, which obviously is normal. And even now, I'm still coughing up the odd, like, it's like a jelly type stuff. I don't know what else to describe it as, but like a jelly. And sometimes, particularly in the morning, first thing, there's a few little blood clots in, which probably just settled around, from sort of during the night. Because obviously the wound is all inside, really. So I have this sensation in my throat, which I have to say has been a lot better yesterday and today. It didn't happen straight away. I'd say it happened on about day 3, where when you lean forward, bend down, or even try and lie flat, you get like this. It's like there's something in, not your throat here, not like where you'd have a sore throat, say, if you've got a cold, but like, I suppose it is lower than, it's like your vocal cord area. Like something's digging in a bit inside, and I guess it is literally the swelling and the bruising. My consultant did say you will definitely have some degree of that. Everybody will have. Some people just find it worse than others, and sometimes you can feel like you can be eating something and you can feel like almost like you're going to choke on it, like you can't get it down. And I was a bit worried about that because I knew that after my op I'd be on my own quite a bit. As it happened, my husband was off for a week. It just coincided with his shutdown for work. So for the whole week after surgery, I wasn't on my own. So that was good. I thought, I don't want to be choking and be on my own. But what I've actually found is if I get this sensation and it becomes a bit of, but most of the time I don't really notice it, but if I do start to notice it and you think, oh, this is really annoying, having something to eat seems to ease it. It seems to be the opposite way around with me. I don't seem to have any trouble swallowing anything. It's if I don't drink. I mean, I've got like a cup of tea now, but I've literally constantly got glass of water or fizzy water or something with a bendy straw, so I can just keep sipping, because that really, really does help keep your mouth and throat moist, because that really, really does stop this sensation a lot. Ice cream, suck on an ice chip, ice lolly, anything just to get a little bit of coldness, a little bit of ice in your throat, really does help. So I think I only took painkillers for about 3 days. I think day 4 I had a little bit of like neck and shoulder stiffness and neck ache, and then nothing really. I was quite surprised, but I haven't had much bruising come out, and I think you always feel better when, you know, the bruising comes out. I'm still really swollen around here, but my wound is healing great. I had 12 what do you call them, staples. Never had staples before. Had them out at my GP surgery. The nurse took them out. They gave me an extractor tool at the hospital to take to her, because they actually don't have them at the GPs. They come from the hospitals. So she whipped them out. Not a thing. Honestly didn't feel a thing. She said I was very good and I didn't flinch. She said most people flinch. So actually, on Saturday, which would have been about day 12, I think, I actually felt like even doing a bit of crafting, which I haven't felt like doing for so long, and I did do a little bit. And then yesterday, day 13, I actually felt a little bit, did I overdo things on Saturday? I felt my neck was quite achy, my shoulders were achy, not painful, just like achy, like really stiff neck and achy shoulder muscles, which they said would ache because that is obviously where the operation deals with. But actually, as the day, I rested yesterday, kind of like here, like I am sitting down now, but I do make sure that I get up and move at least every half an hour, because you do get stiff if you don't. But actually, as the evening went on, I realised it feels a little bit more like bruising rather than pain. But I have been taking paracetamol through yesterday and still today, and I woke up a little bit stiff this morning, but actually it's eased off again today, but I'm still being careful. When I'm sitting, as you can see, with my neck supported. I've got the sofa, I've got a cushion behind my back, and then I've got a big V-shaped cushion. You can't see it, but it's behind me, and that is amazing. That is it. It keeps me just the right amount of uprightness, and you can kind of obviously adjust it to how you want to be. I've also got, you can't see it, but I've also got a small footstool, so I've got my feet up, which helps with your positioning of your spine as well. But I had that pre-surgery as well, because I just found it more comfortable. What else can I say? The one thing I would say that's been the most uncomfortable is bed. Not so much getting comfortable, apart from the first couple of nights, obviously, which you'd expect were a little bit uncomfortable. I'm not a back sleeper. I'm a side sleeper, and I couldn't get on my back for a while. I couldn't get on my side for a while. I could lie on my side and I was comfortable, but I didn't feel it was supporting my neck enough. I've got a pillow and I've got another V-shaped cushion on my bed as well. So now I can get comfortable to sleep, but it's not my natural sleeping position. So I'm finding that hard rather than it hurting from the surgery. I do find that it is waking me up probably 2-3 o'clock in the morning, because you do get stiff if you don't move, but it's probably good that it is waking me up, because there was one night that it didn't wake me up and I slept right the way through till about 7 o'clock. And I was so stiff when I did wake up because I hadn't moved at all during the night. So I'm finding that when it does wake me up, I get up, have a little walk around, just loosen myself up a little bit, go back to sleep, and it's been fine. Now I'm finding I'm kind of sleeping through till about 5 or half 4, 5. And that's okay. That's not too bad. It's not too long. If I do wake up in the night, I tend to have some paracetamol, and that helps me to not be stiff, sort of as stiff when I wake up. It does say on the care leaflets from the hospital, you've got like a exercise sheet and that one of the main things that people do is come off their pain relief too quickly. And yeah, I think I did, because it's not painful. You think, oh, I don't need them anymore. But I think you do, just for that stiffness and that ache in your shoulders. It just keeps it down to a more less noticeable achy level. So regarding movement, I'm pretty much normal. I've been going to walk every day, apart from I think it was Saturday because the weather was so awful. That's mainly to help with blood clots, stop anything settling on my chest. Walking's good, just about for most surgeries anyway. I've got a sick note for 3 months post-op, so I think that runs out. I think it's like the end of January. Because I've got quite a manual on my feet physical job. I found not so much the last few days, but coughing a little bit more, but that doesn't hurt. You would think that coughing would actually hurt you, but it doesn't. But oh my goodness, what I wasn't I mean, it's not even something I think of. If there's one thing that has been so painful, and the first time it happened, I was so glad I was sitting down, and that is sneezing. It hurts your throat, and of course when you sneeze, you don't really think about it, but your head goes forwards and back really quickly. You flex your neck. It hurt, guys. It really, really hurt. So now, if I feel a sneeze coming on, I kind of sit down or brace myself against a wall and kind of really brace for it, because that really does hurt. That is the only thing that I found really, really painful, of all things, sneezing. I think they should warn you about that one. But yeah, generally, I think it's been good, and my recovery's been a lot better than I expected. I say my husband was off for a week after my surgery, so he was doing all the cooking, so I didn't have to bend down. Or the one thing I can't do is load a washing machine or empty a washing machine for 6 weeks, lift above my head height, lift anything higher than a kettle, heavier than a kettle, like filled with water. Have done a few things I shouldn't, probably, but it's really difficult to do like absolutely nothing. But just be careful and remember, although you can't see your wounds kind of thing, they are there inside, and I do feel it go tight here if I do something that I probably shouldn't. I feel it. So yeah, what I'll do is I'll maybe come on in maybe a couple of weeks or so and do another little update and just let you know how I'm going on, just for the benefit of people going through this surgery, in the future. So thanks for watching, guys, and all stay safe. Bye.